Good evening and welcome. It's Nurse Eunice with Florida Training Academy. And in this evening's video, we're going to be discussing body systems for CNAs and PCTs, and we're covering the heart and the lungs. So as we do in each of our videos, we'll give you about 10 seconds to receive your notifications. And hi, Mila, Crystal, Luis, and also Unicorn Sprinkle. We'll get started in a few moments. All right, so I hope everybody's been having a wonderful Wednesday. We're going to get started now. And let's talk about the function of the cardiovascular system. So, the cardiovascular system includes the heart, blood, and blood vessels. Its main job is to pump oxygen rich blood and nutrients throughout the body while removing waste like carbon dioxide. And Crystal, good luck. I see you take your test tomorrow. Why, as a CNA, do you need to know about the cardiovascular system? Because by knowing how the cardiovascular system works, you can better recognize the signs of heart problems like chest pain, shortness of breath, swelling, or abnormal vital signs. This helps you to report the concerns quickly to your nurse, assist with positioning, monitor fluid intake, and support patients with conditions like heart failure or high blood pressure, leading to safer, more effective care. All right, so grab pen and paper. Make sure you jot down your notes. Don't also feel free to put any comments in the chat area. And for those of you all who are saying you've passed your test or your exam is upcoming, congratulations on passing your exam. And for those with upcoming tests, I know you're going to do well. All right, let's get started, team. Good luck, everybody. All right, question number 1. A resident with a history of heart disease suddenly complains of chest pain and appears anxious. Based on this observation, what could be the cause of the resident's symptoms? And what is your best first action? Remember, you're the CNA, you assist the nurse. Is it going to be A, the resident is likely dehydrated, offer water and encourage deep breathing? B, the resident might be choking, place them in a sideline position. C, the resident is having muscle cramps, help them walk to the nurse's station. Or D, the patient or resident may be experiencing a cardiac event. Call the nurse immediately and stay with them. What do you think the best response is, team? You're not the nurse, but you work so closely with us where if you tell us that something's not right with a patient, we're getting up. We're going to go check. So that is right, everybody. You have the correct response. I am so proud of you. If you chose D, great job, team. So, chest pain in a resident with a history of heart disease could indicate a heart attack, or another term we use is angina. You may also hear people say angina. The CNA or PCT should recognize this as a potentially life-threatening situation. So the best response is to stay with the resident, remain calm, and press that button. Get that nurse in the room right away. Delaying care or encouraging movement could worsen the condition. And so many of you all got the answer right. Great job. Question number 2. A resident with congestive heart failure is on daily weight monitoring. This morning, their weight has increased by 4 pounds since yesterday. What should you do, CNA? Is it A, tell the resident this is normal for the weight to change daily? B, encourage the resident to walk to lose weight? C, report the weight gain to the nurse immediately? Or D, ask the resident if they ate more food than usual? All right, revealing the answer in 3, 2, and you're so smart. You got that right. You knew that it was C. Report the weight gain to the nurse, because no one should gain 4 pounds overnight unless they have worsening heart symptoms. So sudden weight gain can indicate fluid retention, which may mean that the resident's congestive heart failure, or CHF, is worsening. This requires immediate attention from the nurse. And I chose this image because, of course, it shows the edematous lower extremities. Don't ever get a patient up without socks and walk them around. But if this was a patient that you took to the scale and you saw those legs were swollen, more than likely, if that fluid continues to back up, they're going to also start having breathing problems due to the fluid retention. So please make your nurse aware, because no one should gain 4 pounds in 24 hours. And then let's see, I'm so proud of you. The Lion says, thank you, Nurse Eunice. I passed my CNA exam on the 13th. You are so welcome, and congratulations and good luck with your nursing career. All right, question number 3, everybody. Which of the following foods is best for a resident with high blood pressure? Is it A, canned soup and salted crackers, B, grilled chicken and steamed vegetables, C, fried chicken with mashed potatoes, or D, a ham sandwich with potato chips? And so I've been working all day. D sounds really good. I'm going to drink my water and go home and eat a salad. But with that being said, you all know the correct response. The correct response is B, grilled chicken with steamed vegetables. They need a low sodium diet. So a low sodium diet is recommended for hypertension. Processed and fried foods are high in salt, which can increase the blood pressure. All right, question 4, my geniuses. A resident is experiencing dizziness when standing up. What should you do first? Is it A, ignore it since dizziness is common in older adults? B, encourage them to walk slowly to their room? C, give them water and have them try again? Or D, have them sit back down and report it to the nurse? I see some mixed answers. I see D's, I see B's, but it looks like the D's have it. You are absolutely correct. So dizziness upon standing may indicate orthostatic hypotension, which is a sudden drop in blood pressure with position changes. The CNA should prevent falls and report this to the nurse. So whether you're working on a medical surgical unit or your first job could be in a nursing home, it could also be on the telemetry unit. Telemetry is the monitoring of the heart. So depending on where you work, you're going to have a lot of patients with cardiac issues. You stand them up, they get dizzy, you sit them back down. Make sure you don't move them too fast, have them sit on the edge of the bed, make sure their shoes are on their feet, and then stand them and of course ask about dizziness. If they say that they're dizzy, get them right back in the bed. So you sit me up and you say, Miss Eunice, how do you feel? Are you dizzy? And I say, oh no, I'm fine. But now when you stand me up, I say, ooh, I'm dizzy. Don't go any further. Put me back in the bed, get that nurse in the room, because that means that more than likely my blood pressure dropped due to the orthostatic changes. And see, that's when your nurse will start asking for you to get orthostatic blood pressures, which means you'll get a blood pressure with your patient laying down, sitting upright, and standing. And you'll report those findings to your nurse. All right, question number 5, team. A resident with circulation problems complains of cold feet. What can you do to help? Is it A, keep their legs elevated above the heart? B, apply warm blankets or socks? C, massage their legs to improve circulation? Or D, soak their feet in hot water? And Naomi, we're glad to have you too. And yes, Mila, I'm having a great day, and I hope everybody is also. All right, patient with cold feet. What do you do as a CNA? Oh, I tricked some of you all. Some of you all are choosing A. A is not the correct response, because if you elevate the legs above the heart, that means that you're taking the blood flow from the legs and taking it back towards the body. So of course their legs and their feet are going to be cold and numb because there won't be any blood flow there. So everybody revealing the answer in 3, 2, and 1. The answer was not A. It was B, warm them up the regular way. So keeping the feet warm can promote circulation without using excessive heat, which can be dangerous for residents with poor sensation. And so with the image, if you can see her feet, they are mottled. So that is MOTTLED. They're kind of purplish and pale in certain areas. So that would be a sign of poor circulation. And when something gets cold, of course, it cuts the blood circulation or the blood flow off. So try to keep their feet warm and put some socks on their feet. All right, question number 6. What vital sign is most important to report in a resident with heart failure? Would it be a blood pressure of 118 over 78, a heart rate of 88 beats per minute, a heart rate of 48 beats per minute, or a temperature of 98.2? And to give you about 5 seconds to put your answers in the chat. Oh, we have a lot of B's. We have a lot of C's. Chelsea says V. All right, everybody, revealing the answer in 3, 2, and I'm so proud of you. You knew it was C because a heart rate of 88 is normal. However, a heart rate of 48 indicates bradycardia. And so for those of you all who know the normal range of a heart rate, aka a pulse rate, please put it in the chat. So a heart rate below 60 beats per minute is bradycardia. And with this patient, it may indicate worsening heart function, and that should be reported to the nurse immediately. Don't forget to document. And yes, Mila, TED holds are used on patients with congestive heart failure, but it's usually used to maintain the pressures or to decrease the amount of fluid that's in their legs. And Naomi has it. That is right. It is 60 to 100 beats per minute. So great job. All right, question number 7. Let's see if you can answer this one correctly. A resident has swollen feet and ankles. What is the best way to help reduce swelling? Is it A, encourage them to dangle their feet over the bed? B, apply an ice pack to the swollen area? C, have them sit in a chair for long periods? Or D, elevate their legs on a pillow while they are lying down? And I see you, Miss Benita. Yes, you have that right. Oh, these are too easy for you all. You all are ready to go working in the hospital, on the med surg floor, on the telemetry floor, because you definitely understand the basics of cardiac care. So yes, you're going to elevate those legs and those feet. So it's going to be D. Elevating the legs helps to reduce the buildup. And when we say improve circulation, it's because it's taking away that excess fluid. It's bringing it back towards the center part of the body. And so this is what you'll be doing for those patients who have swollen legs. And then as Mila already said, sometimes there will be an order for TED holds or those compression stockings, and you'll help to put those on the patient also. Question 8, a resident with peripheral artery disease, also referred to as PAD, complains of leg pain when walking. What is the best response? A, encourage them to keep walking through the pain. B, massage their legs to relieve the pain. C, have them rest and notify the nurse. Or D, apply an ice pack to their legs. Ow, my legs are hurting when I walk. Ouch. What do you want to do, team? And you're absolutely correct. The answer is C. Put them back in the bed. All right. And then you're going to let your nurse know. All right. We call that intermittent claudication. And so that is pain due to poor circulation. And it's common in patients with PAD. So the resident should rest. You can elevate those legs, and then the nurse should be informed. And maybe the nurse can give them a Tylenol or something in order to decrease the pain, because we need them to walk. We just don't want them being in so much pain when they do so. Question number 9. So a resident with heart disease is on fluid restrictions. Which of the following is the best way to assist them? Would it be A, give them water throughout the day? B, ignore the restriction since it's not a medication? C, leave them in the room with a full pitcher. Let me repeat that. Leave them in the room with a full water pitcher and trust them to adhere to the fluid restriction. Or D, offer small sips of fluid as allowed and track the intake. So your patient who has heart disease has a fluid restriction. What would be the best response? And so many correct answers. That's right. We don't want them dehydrated, but we also don't want them to have so much fluid until they can start retaining it and it causes their heart symptoms to worsen. So the answer is going to be D. So you can offer small sips of fluid. You just have to track it. You be putting down. So if you gave them 100 mLs with their breakfast and 100 mLs with lunch, because sometimes your doctor will restrict them to 1,000 mLs or 1 liter for the entire day, and that's 3 shifts. So we have to divide the fluids appropriately. So fluid restrictions can help prevent fluid overload in residents with heart disease. And as a CNA, you're going to track the fluid intake. Please don't leave that pitcher full of water in the room with the patient, because they're going to drink the water. They're not going to adhere to the fluid restrictions. And so what are symptoms of water retention? It is going to be swelling. They can have bloating in the abdominal area. Maybe they're puffy, or they can have muscle stiffness and also fatigue and lethargy. All right, question 10. A resident suddenly becomes unresponsive while you are assisting them in the bed. What should you do first? Would it be A, check for breathing and call for the nurse? B, leave the room to get the nurse? C, shake them to wake them up? Or D, sit them up in bed? Oh, you all are fast with this one. I see you, Tori and Crystal and Vanessa and Chrissy and Miss K and Anna K and Risha and Naomi and Leslie and Lois and Darcel and Elizabeth and Chelsea. You have it right. It is A. So anytime a person becomes unresponsive, that is a medical emergency. And for this one, it just said check the breathing. But of course, you have to know CPR because you're working in a facility. So they're going to teach you how to check for a pulse and a breathing simultaneously. And you're going to check that for 10 seconds. And if there's no pulse, there's no breathing, you're starting CPR. Your nurse isn't going to be there within 10 seconds. You're going to be starting CPR before your nurse ever enters the room. So if a patient is unresponsive, you're going to again be checking for those signs of life. You're going to hit the code button, which is usually above the patient's head of the bed. That's the panic button. You're going to lower the head of the bed, get on that chest, and start doing chest compressions on the bed. And when the team arrives, that's when they will assist you further, put the board beneath the patient's back, and a team leader will take over the compressions and also take over the code. So, but you are the first one in the room most of the time. You're going to be the first one to start the compressions. And if you don't have any type of protective device, you'll just be doing hands-only CPR. You will not be giving breaths. So whenever the crash cart arrives, we usually have bags on the crash cart. Some people call those ambu bags, but they're called resuscitator bags. Whenever the bag comes that's on the crash cart, that's when we'll give breath. So to recap, hands-only CPR. Do not put your mouth on a patient's mouth because you could contract something or you could be giving your patient something. And we don't want you to have to go out with workers' comp because you contracted a disease. All right, question number 11. A resident has been placed on fall precautions due to dizziness from low blood pressure. What is the best action you can take to prevent falls? Is it A, encourage the resident to move quickly to avoid dizziness? B, have the resident use a walker or cane when moving? C, lower the bed, ensure the call light is within reach, and assist them when needed? Or D, tell the resident to avoid getting out of bed completely? Well, geez, are we going to make them bedridden? So we know the response isn't D. Revealing the answer in 3, 2, and that's right, Elaine. You have it right, everybody. It is C. So you're going to lower the bed, ensure the call light's within reach, and assist them when needed. So fall prevention measures should include ensuring that the bed is at a safe height. So you always take that bed down to the lowest working position, to the lowest position that's good for the patient. The call light is accessible. It should be left in their hand. And if they move it somewhere else, at least we know it's within their reach. It's not on the coffee table. It's not on the bedside table. And that the resident is assisted when moving. So Mr. Mitchell, I understand that you sometimes like to get out of bed without help, but here's your call bell. It's really important that you call me and I will come in and walk you to the bathroom. That's what's safest for you right now. All right, question number 12. A resident with CHF complains of shortness of breath while lying flat. What do you do, CNAs? Do you want to A, lower the bed to encourage relaxation? B, elevate the head of the bed and notify the nurse? C, tell them to lie on their side and take deep breaths. Or D, encourage them to drink more fluids. And I know everyone's going to get this right. We're going to have 100% on this one. And you all have it. The correct response was B. So this is an illustration of the high Fowler's position. And so this person is upright almost, or sometimes we'll say 60 up to 90 degrees. This person's definitely at 90 degrees, but it's to the patient's tolerance. You want to sit them up. If you have to put pillows behind their back in order to keep them into this position, that's fine too. But elevating the head of the bed improves breathing by reducing fluid buildup in the lungs, which is a common issue with congestive heart failure. Question 13. Today, you're on Nurse Eunice's med surg floor with a lot of cardiac and pulmonary patients. So a patient with high blood pressure, aka hypertension, asks for a snack. Which option is the best for them? Would it be potato chips, salted peanuts, fresh fruit, or instant ramen noodles? And as a new CNA or a new tech, your patients are going to be trying you. They're going to be like, well, I want bacon for breakfast. Why can't I have bacon? And you have to remind them of their diet. Well, Mr. Mitchell, you're on a cardiac diet, and because bacon has a lot of sodium or salt, you're not able to have that. But this is what you can have instead. And so they're going to try to trick you, but you always need to know your diet orders so that your patients are not successful. So question 13, I know you have the answer. The answer is C. Fresh fruit is low in sodium, making it a good choice for residents with high blood pressure. And then something else too is, and this is just for, back knowledge. It's not anything you're going to be telling your patients, but things that are usually yellow or orange are high in potassium. And those who have the adequate potassium intake will usually also have lowered blood pressure. So if you have blood pressure issues, just make sure you start eating some fruits that have yellow color or orange color so you can increase your potassium intake. Question number 14. A resident with a history of a stroke has swallowing difficulty. What is the safest way to assist with their meals? Would it be A, offer large bites of food to speed up the meal? B, have them drink water quickly between bites? C, encourage them to eat slowly and to sit upright? Or D, have them lie down after eating to aid in digestion? And so when someone has a stroke, remember there's either a blockage or a bleed in the brain. And so the acronym, I know you know this, it is FAST, which means they could have facial drooping. One of their arms won't raise up, so one arm is going to fall back down. They could have garbled speech. And if you notice any of that, T is time to call. You're going to press that code button, get your nurse in the room. If you're at home care, you're going to call 911. So now that your patient has had a stroke, they've recovered and they're eating, what do you want to do? And if you chose C, you're absolutely correct. But I have another question for you. They had a stroke on the left side. So that means that the right side of their body could have some paralysis. If they have right-sided facial drooping, whenever you put the food in their mouth, do you put the food in their mouth on the left side or the right side? So to repeat that, your patient who has had a stroke has facial drooping on the right side. When you're feeding them, what side of the mouth do you put the food on? And you're welcome, that girl. That's right, Tori and Priya. Everyone has it. You're going to put it on the left side. So the unaffected side. Great job. Also remember to put the call bell on the unaffected side. If someone has a stroke on one side, you can't be putting the call bell on the side where they can't reach it. So just keep that in mind. Help them so that they will call for help. All right, let's continue. Question 15. While giving a bed bath to a resident with a history of PAD, we already discussed that, peripheral artery disease, you notice a small wound on their foot. The nurse is currently managing another emergency. What should you do next? Is it A, immediately tell the nurse, B, elevate the foot to help improve blood flow, C, soak the resident's foot in warm water to clean the area, or D, finish the bath, then report the wound to the nurse as soon as possible? Hmm. All right, giving you a few more seconds. So far, we are torn between A's and D's. We have a lot of A's, and now I see more D's coming through. So we'll wait for 10 more responses. 9, 8, 7, 6, 5, 4, 3, 2, and if you chose D, you have it. That nurse is managing an emergency. She's over there starting IVs, hanging blood. So the little wound that you found on the foot, even though it is important, it's not an emergency. That is something you can tell the nurse when you're done with your bath. So residents with PAD have poor circulation, especially in their lower extremities, which can increase the risk of serious infections and delayed wound healing. CNA should never apply lotion, elevate, or soak a wound without direction from the nurse. The best action is to calmly finish the bath while taking care to not irritate the area, and then report your findings promptly when the nurse is available. So if you're that concerned about it, like if it's life or death, and your nurse is busy, that's when you can go to the charge nurse or you can go to another nurse on the floor. But the wound on his foot was not life or death. So please don't bother your nurse right away. You'll see her in the hall in the future, and that's when you can notify her about that wound that you noticed. So great job, lifesavers. Question 16. While assisting a resident with a history of heart disease, you notice they suddenly become pale, sweaty, and they complain of nausea. You have already called the nurse, but the resident now insists that they need to go to the bathroom. I don't want to throw up in bed. I want to go to the bathroom. What should you do next? A, offer them water to help with the nausea. B, help them lie down and calmly reassure them until the nurse arrives. C, assist them in walking to the bathroom since they are alert. Or D, apply a cold cloth to their forehead while they sit up. All right, and so while you're answering that question, Elizabeth asks, is it best to do a body check before bathing a resident or a patient? You actually do it during the bath. And so the visual skin that's not under the gown, the arms and the legs, you can kind of see those and you'll notice any new markings. Now you get her and take her to the bathroom, you pull down her let's say she has on Depends or an incontinent brief. Now you can do a back assessment. But in order to sometimes see those feet, you got to take those socks off. So when you do a bath as a CNA or a PCT, that's when you as the caregiver assisting a nurse would be able to see the full skin. And then the nurse should be doing those similar assessments. So you're doing assessment of the skin and the nurse also. So I hope that helped to answer your question. All right, everybody. So the answer to 16 is yes, you all have it. So proud of you. It is B. So he needs to stay in that bed. He cannot get up right now because those are potential signs of a cardiac event, such as a heart attack. So yes, whenever they start having that epigastric pain and they become nauseated, that is sometimes a sign of not GI issues or stomach issues. It's a sign of a heart attack. So keep him or her in the bed. Even if the patient feels the urge to use the bathroom, standing or walking could increase the strain on the heart. Safety is the priority. You can give them a bed pan if they need to urinate or have a bowel movement. You can give them a bath basin if they need to vomit, but don't get them out of bed. Help them lie down. They're not lying flat, but they're in the bed. Stay calm and wait for the nurse to assess the situation. You should never leave the resident alone or encourage too much movement in this scenario because it could strain their heart even more. All right. Milo, why would they need to vomit? It's sometimes just a sign of, excuse me, it's just a symptom of having a cardiac event. So some patients, especially men, they don't think that they're having a heart attack. They're like, oh, I just feel like I have indigestion. It feels really bad. So as far as the anatomy and physiology behind it, I'll have to get back to you, but we just know it's a symptom. So right now, I don't remember why. Remember, I've been a nurse for 26 years, so I don't remember everything. I don't remember why, but just know that GI distress can be a precursor of a cardiac event. All right, let's go to our next question, question 17. What is the best way to improve circulation in a resident who's on bed rest? Is it A, encourage them to move their arms and legs frequently? B, have them stay still to prevent blood clots? C, massage their legs firmly every 2 hours? Or D, lower their legs below the heart level? All right, revealing the answer in 3, 2, and we have a lot of C's and we have a lot of A's. And so to improve circulation, let your patient do the work. So if you all are just massaging, we need to remind them that, hey, this is your body, this is your condition. If they can do the exercises, that's called active range of motion. If you have to do it for them, that is passive range of motion. You have 15 patients. You don't have enough time to be massaging people. This is not massage therapy. So you're going to do A, you're going to encourage them to move their arms and their legs. And so we have them like do their feet, like, okay, let's do some gas pedals. Let's lift the arm. Another way you can encourage them to move is to actually include them in their care. If they need to eat and they can move an extremity, you're not feeding them. You're putting a towel on their chest and you're encouraging them to feed themselves. You're letting them comb their hair. So even that movement is going to help improve circulation and decrease blood clots. Question 18. A resident who has had a stroke is unable to move their left arm and leg. How should you position them in bed? Is it A, keep them flat on their back? B, lay them on the strong side at all times? C, position them with a pillow supporting their weak side? Or D, let them position themselves however they prefer? They had a stroke. They can't move the left side of their body without your help. So what do? We have a lot of A's. We also have C's. Revealing the answer in 10 seconds. 5, 4, 3, 2, 1, and my C's have it. It is C. We're going to make sure that we position, we're going to support the weak side. So proper positioning helps prevent pressure injuries and improves comfort for stroke patients with limited mobility. So let me go back to A because a lot of you chose A. We're not going to keep them flat on their back because even if they may have had a stroke, they still could, sometimes have a modified diet. Maybe they have respiratory issues. So it's not necessary to keep them flat on their back. I'm so happy that no one chose B. We're not going to keep them on their strong side the whole time because if we have them on their strong side, they won't be as independent because we actually have them laying on that side. So you can put a pillow under their arm. You can put a pillow under their leg on the weak side, keep it propped up. And sometimes when a person has a stroke, they may neglect one side of their body, like they forget it's there. And if it gets trapped or if it gets under their body, they don't even feel it. So keeping everything in front of them supported helps to not only protect it, but it helps to remind the patient that, hey, that other side of the body that you don't feel is still there. And I need you to make sure that your arm is positioned properly. So again, keep including them. Question 19. You are checking the vital signs of a resident with a history of high blood pressure. Which of the following readings should be reported to the nurse immediately? And I'm not going to call these out. You can see them on the screen. I want you to tell me which reading the nurse needs to be made aware of ASAP, stat. Oh, you all are good and you're fast. Oh, I'm so proud of you. Revealing the answer in 3, 2, and If you chose C, 162 over 98, you are right. So a blood pressure reading of 162 over 98 is considered hypertensive, which puts stress on the heart and arteries. This is especially concerning in a resident with a known history of heart disease. That means it's not regulated. Maybe your nurse needs to give them another pill to bring down their blood pressure or to call the doctor to let them know that the interventions we've been using, they aren't working. So that's why, as a CNA, you should report the readings to the nurse immediately. Don't forget that when you report it to the nurse, you also need to go back and document what the vital signs were and that you reported to the nurse. Remember, if you don't document it, you didn't do it. And if that nurse is really busy, she may forget that you told her the blood pressure was elevated. And if something, untoward happens to the patient, we don't want a nurse blaming you. So you tell the nurse, you document the vital signs, and you document that you also let the nurse be made aware. Question number 20, team. You are obtaining vital signs for a resident who is recovering from a heart attack. Which of the following heart values is normal and would not need to be reported? Would it be 58 beats per minute, 102 beats per minute, 112 beats per minute, or 88 beats per minute? Which one is normal? Great job, team. You all are amazing. You all know that the heart rate in an adult, the normal heart rate, is 60 to 100 beats per minute. So a heart rate of 88 falls within the normal range, and you would not have to let your nurse know unless the patient had some other symptoms. But that would be normal. And in most of your facilities, you would only let the nurse know when something would be abnormal or outside the parameters. Question 21. A resident with a pacemaker is being sorry about that. A resident with a pacemaker is being transferred to a wheelchair. Which safety measure is most important? A, avoid bumping their chest during the transfer. B, encourage them to grip the armrest tightly. C, avoid using pillows behind their back. Or D, lower their legs below the heart. I have 2 bits of great news. So Delma, congratulations on passing your test. And then, I don't want to miss it. Is it Dua? Hey, congratulations on passing your test too. Hey, I'm so happy that you're over the moon. I am so proud of you guys and gals, and I wish you all much success because from CNA, just all the doors are going to open for you. So whether it's LPN, RN, if you want to go to sonography, there's just so many opportunities, and I appreciate you all for just joining us and studying with us. All right, everybody. Let's reveal the answer in 3, 2, and if you chose A, you got it. So, what is a pacemaker? A pacemaker, whenever someone's heart rate is low, bradycardia, they can put a surgical implant into the chest wall, and that is going to pace the heart. It's going to stimulate. It's going to send energy that makes the heart contract. And so most of the time, it's going to be set between 70 to 80 beats per minute. And so in the image, when you see that little circular area above the heart, that would be the pacemaker. Whenever a patient gets a brand new pacemaker, sometimes they're going to have a sleeve or a sling, on the arm nearest the pacemaker site. So as a CNA, you have to know that they can't move that arm too much, because if they do, they could dislodge one of the leads, one of the wires that's helping to pace their heart. So if a patient has a pacemaker, your job is to protect the site and to protect that arm if it's newly implanted. All right. It's so much good news here, everybody. And so I wanted to share that I got a job at a local hospital on the patient care surgical. I'm so proud of you, Crystal. All right. So much good news, you all. You make me so proud of you. And I know you're going to learn so much on that floor, Crystal, and you're going to be a great asset. All right, question 22. A resident with heart disease asked, so there's so many comments going through. I have to get the questions done. So a resident with heart disease asked why they must be weighed every morning instead of at bedtime. What is the best response? A, weighing at night helps track how much you ate during the day. B, morning weights are more accurate because your body has less food and fluid. C, it doesn't really matter what time, just as long as it's done daily. Or D, we do it in the morning to make sure you're hungry for breakfast. So many correct responses. I'll give you 5 more seconds. So 5, 4, 3, 2. If you chose B, you have it. The morning weights are more accurate. So, for residents with heart disease, daily weights help to detect fluid retention, which may signal worsening heart failure. Morning weights are the most accurate because they're taken after the resident has used the bathroom and before they eat or drink anything, helping to detect small but important changes in the fluid status. So if you're the CNA on night shift, so your facility, you're working 7P to 7A, about 5 to 6 in the morning, yes, early in the morning, you get your patients up, you're going to have them use the bathroom, and then you can put them on the scale and get their weight. Because if you think about it, in most facilities at 7 o'clock, it gets really busy. And now they're starting to serve coffee, and the breakfast trays come at 7:45 to 8 o'clock. So usually night shift does the weights before they leave in the morning. All right, our next question, team, is going to be question 23. A resident with high blood pressure asks if they can add salt to their food. What is the best response? A, yes, but only a small amount. B, only if you drink extra water. C, no, because salt can raise your blood pressure. Or D, yes, if your blood pressure is normal today. And I will take 1 or 2 answers for this. Let's see what you think, team. I have some C's. I have a D. All right, revealing the answer in 3, 2, and 1. Darcel said D and C. Crystal has it. Where's Crystal? There we go. Depends on the care plan. That is right, because some patients are allowed to have 1 or 2 salt packets. That is it. So for our answer, if you chose C, you're absolutely correct. But if you chose that, yes, you can have some salt, it just depends on what the doctor ordered, how bad their heart condition is. And so sodium does increase the blood pressure. So residents with hypertension should follow a low sodium diet, not necessarily no added salt, but follow the care plan. If the doctor says they can have a packet of salt, usually it's 1 packet of salt and like 5 packets of pepper. So if they're on a cardiac diet, they're going to get way more pepper than salt. All right, that is right, Creative Fam, CNA. I love how smart you are. Question 24. While assisting with morning care, you notice that a resident with poor circulation has dry, cracked skin on their lower legs. What is the most appropriate action? Is it A, apply lotion to the legs as directed in their care plan? B, rub the legs firmly to help stimulate blood flow? C, wash the legs with hot water to soften the skin? Or D, wrap the legs tightly with bandages to prevent swelling? And Mary, good luck. I see you take your test tomorrow. I know you're going to do well. Good luck. I am so proud of you. Yes, it is going to be A. Let's apply lotion if directed in their care plan. So what if their skin is really dry and it doesn't say to apply lotion? Well, in your facility, sometimes they have the lotion that smells like baby lotion. When someone has severely dry skin, that's not the prescribed lotion. That's not the lotion they need. So you would make sure that you inform your nurse, because residents with poor circulation are at higher risk for skin breakdown and infection. Applying lotion as directed helps maintain skin integrity, but it should always follow the care plan and be done gently. We sometimes avoid those perfumed lotions. So rubbing firmly, using hot water, or applying tight bandages could cause injury and worsen their circulation issues. And for those of you all who, as I'm reading the questions, if that helps you study better, remember that when you take your CNA examination, you can request an audio exam. They will give you headphones. The questions will be read to you. The answers will be read to you. I just need you to pass your test. So use those resources and those options if they are available to you. But in the United States, you can have the test read to you on the computer. Question 25. A resident suddenly slurs their speech and cannot move their right arm. What should you do? Is it A, offer them water and help them lie down? B, encourage them to rest and check on them later? C, call the nurse immediately and note the time of symptom onset? Or D, try to have them walk to their bed? And Crystal, that depends on the facility, because if you're working in like a nursing home, your nurse will be responsible for the bandaging. Not all facilities have wound care nurses 7 days a week. So if your patient requires wound care, let that nurse be made aware. And if the wound care nurse can't come, it is that primary nurse's responsibility to take care of their patient. All right, everybody, revealing the answer in 3, 2, and yes, it is C. That is a medical emergency. Call the nurse immediately and remember the time of onset. So sudden weakness and slurred speech are signs of a stroke. Immediate action is crucial to prevent further damage. And you all, we still have 25 more questions to go, but as I do in all my videos, I want to make sure that you don't forget to comment like you're doing, like the video, subscribe to our channel, and share it with your friends. We have thousands of people who use our free resources to pass their test. Plus, I think we currently have very close to 920,000 subscribers. I know that that's not important. The work and the mission that we do as far as teaching you so you can go out and take care of others, that's the most important thing. But it would be so cool for this little nurse from Jacksonville, Florida to have 1 million subscribers. And I know I can do it with you. So please subscribe to the channel if you haven't done so. All right, so now we're on the pulmonary system. So if your patient has a cardiac issue, more than likely they have an issue with their lungs also. So the pulmonary system includes the lungs and airways. Its main job is to bring oxygen into the body and to remove carbon dioxide through breathing. And so they'll refer to it as cardiopulmonary system. The heart and the lungs, they go together. So if a patient has a heart problem, chances are they also have a lung problem. So here we go. Why do you care? Why should you know about this? Because understanding the pulmonary system helps CNAs recognize breathing problems early, such as shortness of breath, low oxygen levels, or noisy breathing. The knowledge is critical when caring for patients with conditions like COPD, asthma, or pneumonia. CNAs can provide better care by ensuring patients are properly positioned, encouraging deep breathing exercises, and reporting changes to the nurse right away. And here we go. Question number 1. Take a deep breath in. Which structure is responsible for carrying air from the throat to the lungs? So we bypass the nose on this one. Is it going to be the esophagus, the mouth, the diaphragm, or the trachea? Which structure carries it from the throat into the lungs? You got to know a little bit of anatomy and physiology to be a CNA. So we have A's, we have D's, we have C's, now we have a B. So we have everybody. All right, everybody. All right, revealing the answer in 3, 2, and if you chose D, the trachea, you're absolutely correct. Give yourself applause. So the trachea or windpipe carries air from the mouth and nose. So it travels from here through here into the lungs. Some of you all chose esophagus. The esophagus carries the food into the stomach, so it wasn't the esophagus. It divides into the bronchi, which then branch into the bronchioles inside of the lungs. So that's why when a patient has a tracheostomy, we have that opening right there. That means that that's now their new airway, and it takes air directly into the lungs. So the trachea was that halfway point. All right, question 2016. At 27, a resident with asthma is having a mild episode of wheezing and shortness of breath. What should you do? Remember, you're the CNA if you're in the nursing home. If you're in the hospital, you're the patient care tech. So what should you do? Is it A, turn the oxygen up? B, encourage the resident to take slow, deep breaths and notify the nurse? C, give them a drink of cold water? D, massage their back to relax them. So they're wheezing and they're short of breath, and you are just going to be like, okay, let me massage your back. So absolutely not. It is not D. But for those of you all who chose B, you have it. So deep breathing helps control asthma symptoms, and of course, notifying the nurse ensures they receive proper care. So if they're in a facility, more than likely they're about to get a nebulizer treatment. You as a CNA or a patient care tech can never change the flow on the oxygen device. What you can do is if it becomes disconnected, you can reconnect it, but oxygen, you have to have a prescription for that. So technically, oxygen is a drug or a medication, and a CNA does not give medication. All right, so question 2018. Great job if you got that one right. A resident is coughing up thick, yellow-green mucus. Let me get my sounds right. Yep, that's the sound. What does this most likely indicate? Is it A, a normal finding, B, dry nasal passages, C, a respiratory infection, or D, a stomach issue? Yeah, I need to get you all used to these sounds and these noises now, because in a few weeks, you're going to be a CNA. And you're going to hear these sounds a lot, especially during the flu season. So September's coming. That's when those bugs, those respiratory germs are going to be at their peak. So September through December. All right, everybody, revealing the answer in 3, 2, and you have it. It's C. You understood that yellow-green mucus is a sign of an infection, and that infection is most likely going to be pneumonia or bronchitis. So if they're coughing up some discolored mucus, let your nurse be made aware, and she's going to ask you to collect a specimen. Question 29. A resident suddenly begins to choke while eating. They cannot speak or cough. What is the best response? Is it A, give them water to help clear their throat, B, call the nurse and wait for assistance, C, slap their back forcefully, or D, perform the Heimlich maneuver, also currently known as the abdominal thrust? What do? Your patient is choking. They cannot speak or cough. Yes, yellow can be a sign of a sinus infection, Jasmine, but this was yellow and green. So when you see green, that is usually more of a pneumonia type infection. So that's from the lungs, not necessarily from the nasal passages. All right, everybody, revealing the answer in 3, 2, and do not give them water. They're choking. Their airway is blocked. It is going to be D. When they stop coughing, you have to go into action, do those abdominal thrusts. So if a resident cannot speak or cough, their airway is completely blocked. The Heimlich maneuver helps to dislodge the object. And for those of you all who may be taking care of patients who are wheelchair bound, let's say that we are in the community area, we're in the dining area at Nurse Eunice's nursing home, and a patient starts to choke, but they're in the wheelchair. Maybe they're a double amputee. It's going to be really hard for you to do abdominal thrusts. So instead, you're going to take the knuckle of your thumb, tuck that in. You're going to put that in the center of their chest, and you're behind them. You're going to cup with your free hand, and you're going to go straight in. So when you think of the abdominal thrust, that's for somebody who's still standing, somebody who is able to stand. But what if it's somebody who's pregnant? You can't be doing the abdominal thrust or the Heimlich maneuver on a pregnant woman. So when you think of somebody who's wheelchair bound, maybe somebody who's a double amputee or someone who is large, do those chest thrusts instead. And you're going to continue doing that until the object is expelled. If the object doesn't come out, they're going to collapse. They're going to go into respiratory arrest. You're going to start, of course, scream for help, start CPR. And after your 30 compressions, you can look in their mouth. And if you can see the object, you can do a finger sweep. Remember, a finger sweep is curved. It's never straight, because if you go straight in, you're going to push that object down more. So you're going to remove that object, and you're going to continue until they have signs of life or until more of the healthcare team comes to assist you. All right, and so that should be something that's taught to you in your CPR class. So CPR should include chest compressions, AED use, and how to help a choking person. Question 30. A resident recovering from surgery tells you they forgot what the nurse said about how to use the incentive spirometer. Mary asks, where can I find the skills? We have a playlist. I know it's kind of hard when you go to YouTube, go to our main channel, go to our playlist. We have a playlist that teaches CPR. We also have a playlist for the CNA skills. So it's definitely there. And if you still can't find it, just send us an email to admin@fltraining.com and ask for the skills playlist, and we'll get that to you. All right, so question number 30. A resident recovering from surgery tells you they forgot what the nurse said about how to use the incentive spirometer. What is the best way to explain the correct steps? Is it A, blow out quickly into the device to clear your lungs? B, take a few shallow breaths into it and then cough hard? C, inhale slowly through the mouthpiece, hold your breath, then rest and repeat? Or D, breathe normally into the device while laying flat in bed? And I am so proud of you all. All right, revealing the answer in 3, 2, and it is, oh, that's not right. You all, it's C. So my response is wrong there. It's not B, it's C. So it's going to be inhale slowly through the mouthpiece, hold your breath, then rest and repeat. So the incentive spirometer is used to help residents take deep breaths to prevent lung complications like pneumonia or atelectasis. That means that the base of their lungs just aren't moving. So we're going to have them take those deep breaths in and out to move that mucus and to cough it up. So the proper technique is here on the screen. You're going to have your patient sit upright. They're going to place the mouthpiece in the mouth and seal their lips around it. You're going to ask them to inhale slowly and deeply through the mouthpiece to raise the indicator. Have them hold their breath for a few seconds to expand the lungs. They can rest briefly and then repeat it. Most of the times they have to do this about 10 times per hour. So a good rule of thumb is to practice anytime there's a commercial. And so as a CNA, you should always remind the patient what the nurse has taught them. So you don't do the first education, but you do actually help the patients because they're going to forget. So you're going to have to provide those reminders. And here we have our incentive spirometer. So for those of you all who don't know what a incentive spirometer looks like, so this is it. All right. So my patient's sitting upright, and with the patient sitting upright, you're going to have them put the mouthpiece in their mouth. Going to have them take a breath in and hold it. And as they take a breath in, the indicator here, this piston is going to rise. And so whenever they get a really good rise, you want to move the lever, because that tells me that the last time we used the incentive spirometer, we got a pull of 500. That is wonderful. So now if they're pulling and you're going to educate them again. No, Miss Eunice, I need you to slow it down. Put it in your mouth and now take a deep, slow breath in. Great job. Hold it and move the indicator. Move it, slide it. And this is going to help them move some of that mucus. It's going to help prevent atelectasis, and it's going to prevent pneumonia. So that's why the use of the incentive spirometer is so important. And they're not going to like it. They're not going to like using it because it makes them cough. We need them to cough. We need that mucus up. So if the cough becomes problematic, maybe your nurse can give them some Robitussin, but still encourage the use of the incentive spirometer. All right, team, question 31. And I know there are a lot of comments. I will go back and look at those comments in a few. Let's get through our last 20 questions. So, what muscle plays a major role in helping the lungs expand and contract during breathing? Is it A, biceps, B, trapezius, C, diaphragm, or D, hamstring? Process of elimination. Which structure is near the lungs? No one better choose D, A, or B. That is right. Darcel. It's not the hamstring. All right, everybody. The correct response is C, diaphragm. So the diaphragm is the dome-shaped muscle located below the lungs. It contracts and flattens to allow the lungs to expand during inhalation and relaxes during exhalation. So if you got something wrong or if you have additional questions, I see Mila's putting a lot of questions. Remember, I am just your online instructor. If you have a lot of questions, write them down and then go and ask your regular professor, or you can actually research online. Just make sure it is a valid site, such as maybe the Mayo Clinic. You want to make sure it is a reputable site. But please, some of the questions you're asking in the chat, don't be afraid to go and ask Google. Just make sure that the site is from a hospital or a major association, such as the American Heart Association. All right, question 32. A resident with a tracheostomy needs their airway cleared. What is your role as a CNA? Is it A, suction the tracheostomy tube, B, apply oxygen and change the tubing, C, remove the tracheostomy and clean it, D, assist with positioning and notify the nurse? Ooh, you're slower with this one, but you're getting the answers right. And that is what counts the most. So, everybody, revealing the answer in 3, 2, and if you chose D, great job, team. Oh, sorry about that. I had a little coughing spell. So it is D. You're going to assist the person, put them into a good position, and then notify the nurse. So CNAs do not suction or remove the tracheostomies, but they do help the patient to sit upright. All right, so sorry for that. Question 33. A resident is ordered to have a sputum specimen collected. What is the best way to obtain the sample? Would it be A, have the resident spit into a dry cup? B, have the resident cough deeply into a sterile container in the morning? C, wipe the resident's mouth with a tissue and place it in a bag? Or D, collect saliva from the resident's mouth? Great job, team. I'm so proud of you. All right, you understand it is B. So we want a specimen first thing in the morning. We don't want spit. We want them to give a good cough. So morning sputum specimens are the best because mucus collects in the lungs overnight, making it easier to detect infections. And so if your specimen has a lot of saliva or spit, you can show it to the nurse, but more than likely she's going to be like, no, this is not a good specimen. You want something that has some substance to it, that's a little more solid. It could be, sometimes it's going to be like this one is like a thick yellow, but or thick white, white in color, but usually it's going to be thicker than spit. So if it's really liquid, that's not the best specimen. Before you throw it away, please ask your nurse. And also, Your patient's usually going to cough on the napkin. When they cough on the napkin, don't throw it away. If they cough on the napkin, you're going to educate them. You're going to say, hey, we're going to give you a cup that you can cough into. Try to spit. Make sure it's really your phlegm or your mucus. But then you want to let the nurse see what the patient coughed into the napkin. So please do put that to the side so the nurse can see it, but that can't be sent to lab. So we retain it so the nurse can see it, but then we discard it. Question 34. A resident with emphysema becomes short of breath while walking. What should you do? A, have them sit down and rest while breathing slowly. B, give them a glass of water. C, tell them to keep walking to strengthen their lungs. Or D, lay them flat on the bed. And this one's super easy, so I'm only giving you about 5 seconds to answer this one. So we're doing the correct response in 3, 2, and 100% of you all got it right. It was A, have them sit down and rest while breathing slowly. Resting in an upright position helps to relieve shortness of breath in residents with emphysema. And so some of these patients, you're going to get them up in just a simple exercise of walking them. It's going to tire them out. They're going to be exhausted. They're going to start having changes in their breathing. So they're going to need to rest often. What you want to have is your pulse ox available so you can detect their oxygen saturation levels. And if their oxygen saturation doesn't return to normal within maybe like 1 or 2 minutes, if it's really, really low, let's say it's in the 80s and you got them up to walk, well, that's going to be a condition or a concern you want to let your nurse be made aware of. So if you walk them, they get tired, all is well, sit them down. All right, take some deep breaths in. Oxygen level should improve. If it doesn't improve, you're going to be calling that nurse. Get her in the room to come and assess that patient. Question 35. A resident with COPD is on oxygen therapy. What should you report immediately? A, the oxygen tank is almost empty. B, the tubing is tangled. C, the resident complains that the mask feels uncomfortable. D, the resident lips are turning blue. Yeah, A is important, but A is not the priority. Yes, everybody, it is D. So the resident lips are turning blue. That is a sign of cyanosis or low oxygen levels. That should be reported immediately to the nurse. And so whenever you have a patient, especially if they're going from the room to a procedure to maybe like the x-ray department to get a diagnostic test, we're going to transfer them to like a portable oxygen tank. So they're going to go from their room's oxygen that's connected to the wall. The nurse will connect it to the oxygen tank. Your job as a CNA is when they come back to the room is to remind that nurse that, hey, she's still connected to the portable oxygen, because that's going to run out of oxygen in about an hour to 2 hours. You want to make sure they get reconnected to the wall unit. Okay. So make sure your nurse reminder, because your nurse is busy just like you are. But if your patient's starting to, start having some changes in their coloration, that could be a reason why, because their oxygen tank is low. Notify your nurse immediately, but the best thing is to prevent it from happening. Question 36. What is a normal respiratory range for a healthy adult at rest? And I know some of you all have given me this answer, so I want to see it now. Is it A, B, C, or D? So utterly proud of each of you. It is C, 12 through 20. So the normal resting respiratory rate for adults is 12 through 20 breaths per minute. A rate below or above this range should be reported, as it could indicate respiratory distress or other medical issues. Question 37. Which resident is at the highest risk for pneumonia? Would it be A, a resident who is active and exercises, B, a resident who sleeps in a recliner, C, a resident who drinks a lot of water, or D, a resident who is bedridden and has difficulty swallowing? Who's at the greatest risk of pneumonia? Revealing the answer in 3, 2, and It is D. You are right. So, bedridden residents with swallowing issues are at high risk for aspiration pneumonia due to food or saliva entering the lungs. Question 38. This one's a long one. A resident has been diagnosed with active tuberculosis or TB. As the CNA providing care, what type of isolation is required and what should you do? Is it A, use standard precautions only since TB is not highly contagious? B, follow droplet precautions and wear a surgical mask when entering a room? C, follow airborne precautions and wear an N95 respirator before entering the room? Or D, wear gloves only because TB is spread by touching contaminated surfaces? All right, and this tells me that I need to talk about isolation precautions more and what PPE is appropriate because now I am seeing the right answers, but before you all were kind of everywhere. So revealing the answer in 3, 2, and congratulations if you chose C, you have it. So tuberculosis is spread through the air, so airborne precautions must be followed. This includes placing a resident in a negative pressure room. That means that instead of the germs, when you open up the door, instead of their germs going into the hall, their germs go outside. It goes into a filtered area away from the general public. You also have to have a specialized mask. It's called an N95 respirator, and that's going to help protect you from contracting tuberculosis. You also will have to have a TB test, usually before you start your employment and about every 6 months, or if there is a potential risk that you've been around a patient with TB, and maybe when they were in your hospital, we hadn't confirmed the diagnosis, then you'd have to have another TB test just to be sure. But surgical masks and gloves alone do not provide adequate protection from airborne pathogens. Question 39. A resident has oxygen tubing that keeps falling off. What do you do? A, ignore it since oxygen is not a medication. B, remove the tubing until the nurse comes. C, tape the tubing tightly around the resident's head. Or D, secure it properly and notify the nurse if the problem continues. Yes, you have it. It is D. And so sometimes they have actual commercial devices that will help secure the tubing. If you make it too tight, we usually can cause abrasions or erosion around the ear area. And then something else too, as if your patient's a mouth breather, they're sleeping with their mouth open, having a nasal cannula wouldn't be effective because they're not breathing through their nose. So if you see something like that, let your nurse be made aware because oxygen therapy must remain in place to maintain proper breathing and oxygen levels. Question 40. A resident with tuberculosis is placed on respiratory isolation. What is an important infection control measure? A, wearing gloves when assisting with care. B, ensuring that the resident wears a mask whenever they leave the room. C, having the resident wash their hands frequently. Or D, keeping the room door open for better air circulation. So based off of our previous question, I know that you can already just not choose 2 of those responses because 2 of those are absolutely incorrect. So what do you think the best response is, team? You can eliminate 2. Revealing the answer in 3, 2, and you have it right. They don't have to stay in their room all day. but they do need to put on a mask before they go out. So it's going to be B. Since tuberculosis is airborne, the residents should wear a mask whenever they leave their room to prevent the spread of infection, because they're still going to have chest x-rays. They may have to have a CAT scan or a CT scan of their lungs. And so when they're going through the hospital, we don't need them coughing and spreading their germs. So they're going to have a mask on whenever they leave their room. And of course, you're also going to encourage hand hygiene. But since this is an airborne concern, making sure they have the proper airborne PPE, the mask, is going to be most important for them. Question 41. A resident is making gasping, irregular breaths, and appears unresponsive. What should you do immediately? A, place them in a sideline position and wait. B, shake the resident and try to wake them up. C, give them a drink of water. D, call for help and notify the nurse. That's right, Crystal and Fabi and Mary and Chrissy and Kelly and Tori and Carmina and Roy and Emilia. It's a lot of you all. It's so many of you all joining us this evening, and I appreciate you. If I didn't call your name, just know that you still got the answer right, because I see your responses. Yes, it is D. So those irregular gasps are a precursor to cardiac arrest. Their heart is about to stop. So agonal breaths are gasp, irregular breaths that are seen in cardiac arrest. So this person they're unresponsive. If you felt for a pulse, you would not feel a pulse, but they're having air that is escaping. They're gasping. You're going to press that panic button, hit that code button, and you're going to start your CPR, because immediate medical attention is needed. Question 42. A resident with sleep apnea frequently stops breathing during sleep. How scary. What is the best position to reduce the risk of airway obstruction? Would it be having them lie flat on their back, have them sleep on their side with their head slightly elevated, having them sitting upright in a wheelchair, or is it going to be D, having them lie in a prone position, which means to have them sleeping on their stomach? What is going to be the best for somebody who stops breathing while they sleep, aka sleep apnea? And don't forget, anytime someone has irregular breaths, when you're taking your CNA test, by default, you have to count the respirations for 1 full minute. In the real world, you start doing what you see other people doing. You develop bad habits, and you'll count the respirations for 15 seconds and multiply by 4. If a patient's respiration rate is irregular, you must count the respirations for 1 full minute. So somebody with sleep apnea, and you just guesstimate, be like, oh, it's 12. The respiration rate could actually be 10. So you want to let your nurse be made aware, count for 1 full minute if anything is irregular, whether that is a pulse or breathing. So for this one, everybody, if you chose B, you are correct. So side lying with slight elevation helps to keep the airway open and reduces apneic episodes. And so this is a device, a BiPAP, that's going to be a machine that you'll commonly see in the rooms of patients who have sleep apnea. Question 43. Which resident is most at risk for aspiration pneumonia? Is it A, a resident who eats quickly and talks while eating? B, a resident who drinks only thickened liquids? C, a resident who sleeps with their head elevated? Or D, a resident who has a strong cough reflex? I see a few different responses here. So let's talk about aspiration pneumonia. Aspiration pneumonia is when this person wasn't coughing until you came into the room and you started feeding them. And now they're starting to cough. That is an indication that instead of the food going to the esophagus, down into the stomach, is entering their trachea. And if they don't have a strong cough reflex, that food is going to go into their lungs. And whenever that foreign body enters the lung, it is going to be a breeding ground for germs, aka aspiration pneumonia. And so who would be at greatest risk for aspiration pneumonia? If you chose A, You got it. Limit those distractions. Sit them up and cut off that TV. So eating too fast and talking while eating increases the risk of choking and aspiration, which can lead to aspiration pneumonia. Question 44. A resident is coughing violently after drinking water and their face turns red. What should you do? A, give them more water to clear the throat. B, perform the Heimlich maneuver immediately. C, lay them flat in bed. Or D, let them continue coughing and encourage deep breaths. Oh, this was tricky. It's not too tricky because Tenzin, Tori, Emilia, Fabi, Christy, you all got it right. So if someone is coughing, they're not choking. If they're coughing, you tell them to cough. Do not hit them in the back. When you hit them in the back, they stop coughing because you push the fluid or the food down into the lung, which means next week they're going to have pneumonia. So encourage them to cough it up. The answer is going to be D as in dog. Coughing is the body's way of clearing an obstruction, encouraging deep breaths and monitoring for worsening symptoms. But usually if you encourage them to cough, they're going to be fine. If they stop coughing, that is when you perform the abdominal thrust, aka the Heimlich maneuver. And whenever you are in fear that your patient's not going to get better if they don't improve, because he did turn red, press that button, get your nurse into the room. Question 45. Which of the following, so this would mean like an oxygen saturation, SpO2. Which of the following SpO2 readings would be considered normal and not require immediate action? Would it be an oxygen level of 88% on room air, 95% with oxygen, 97% on room air, or 91% with oxygen? So the question read, which one was normal and did not require any immediate intervention? Meaning you don't have to go tell the nurse. You don't have to sit the patient up. This is just a good reading. And if you chose, oh, we're torn. Oh, you're everywhere. So you all, all right, the correct response is C. So our normal oxygen saturation is above 95%. So without any supplemental oxygen, your patient has an O2 sat of 97%. That's close to 100. That is good. The other ones, kind of questionable. Let's go back to this one. 88% on room air. It depends on what's going on with the patient. I would still notify the nurse and wait for the nurse to educate me. Because some patients, those with COPD, your nurse may not be too concerned, but still your job is to notify the nurse of anything that's abnormal with your patient. We said that 95% was normal on room air without any supplemental oxygen. So this patient's 95% with oxygen. I would monitor that and just tell my nurse, hey, did you know that Miss Lucas's O2 sat is 95%? I know she has oxygen on. I mean, you can also encourage Miss Lucas to cough, to move a little bit, to maybe sit her up. And I'm sure that's going to help with her oxygen levels. Also encourage her to use her incentive spirometer. 91% with oxygen. What do you all think? Is that good or bad? That's pretty bad. The oxygen's not working. So the best response for this question would be C, because 97% without any supplemental oxygen, that person has a normal O2 sat. All right, we are making it to the home stretch, everybody. We only have a few more questions to go, and I'm so proud of you. If you joined late, don't forget to like the video, subscribe to our channel, and then on Friday, Saskia will be on, and she, of course, is our Haitian Creole translator. On Monday, Nurse Jackie will be on back at 7:30 p.m., and next Wednesday, I'll be back on at 6 p.m. So we're going to start putting these videos out at least 2 to 3 times a week to help you pass your examinations. So question 46. A resident on oxygen therapy says their mouth is very dry. What is the best way to help them? A, turn the oxygen setting down. B, remove the oxygen for a few minutes to let them breathe normally. C, encourage them to drink plenty of fluids if not restricted. Or D, apply Vaseline inside their nose. All right, so Risha has a question. On room air / with oxygen, is there a difference? So yes, right now, when you're sitting in your room, you do not have an oxygen device. You don't have a nasal cannula. You don't have a face mask on. And so the majority of your patients will also be the same way. We call that room air. They're breathing in the normal oxygen levels. So normal on room air is greater than 95%. With oxygen means they can have a nasal cannula or they can have a face mask, can't say it right, face mask on. And so that's what we mean when we say with oxygen. It's supplemental oxygen. All right, so I hope that answered your question, Risha. All right, so here we go, everybody. I know you know the answer to 46. Revealing it now. It is C. So don't be applying that Vaseline because sometimes they're petroleum based, and that's not the best thing. If they're really dry internally, your nurse can humidify the oxygen. She can give a saline nasal spray. But as far as the CNA is concerned, the way that you're going to improve hydration is by giving them fluids. So staying hydrated helps, but Vaseline is not safe because it is flammable near oxygen, plus sometimes it's petroleum based. All right, question 47. A resident with chronic bronchitis has a persistent productive cough. What should you do? And after a while, you all, they just complain of how bad their chest hurts because they're just coughing all the time. They have muscle strain. So is it going to be A, encourage them to breathe through their nose only? Encourage them to breathe through their mouth only. B, tell them to limit coughing to avoid disturbing others. C, lay them flat in the bed to rest. Or D, encourage fluid intake if allowed to help loosen mucus. And I know you know the answer because we talked about the spirometer. We've talked about that thick mucus and how to get it to move. They need to cough. They need to be repositioned. They need to use their spirometer. And now you as a CNA or as a PCT, you know that they also need fluids to thin the mucus. So the correct response is going to be D. Fluids help to thin the mucus, making it easier to cough up and clear the airway. Question 48. A resident with pneumonia has a respiratory rate of 8 breaths per minute. What do you do? Is it A, encourage them to take deep breaths, B, report it to the nurse immediately, C, have them drink fluids, or D, sit them in a recliner to rest? And we're revealing the answer in 5, 4, 3, 2, and everybody has it right. It is B. So a respiratory rate of 8 breaths per minute is dangerously low. That's really close to 0 and may indicate respiratory failure. So why would your patient's respiratory rate be so low? Pain medicines, they either came out of surgery and maybe they have too much anesthesia, so they can have respiratory compromise due to medication. So get your nurse in the room and try to stimulate your patient. So you can do the whole, hey, are you okay? But when your nurse comes in the room, you just, some places still do this. They're going to do a sternal rub to try to stimulate the patient. You do not do a sternal rub. Your nurse does it. All right, question 49. You are caring for both adult and pediatric patients. So let me tell you this. If you're caring for both adult and pediatric patients, that means you're in the ER. That means you are a fantastic tech. That means you know your stuff. All right, let's keep going. Which statement best describes the difference between normal respiratory rates in children compared to adults? And this is a lot to read, so I'll try my best. A, children have slower respiratory rates than adults due to their smaller lungs. B, adults breathe faster than children because they have larger lung capacity. C, children normally breathe faster than adults because their bodies require more oxygen per pound. Or D, there is no difference in respiratory rate between children and adults. What do you think, team? We have B's and C's. So we'll reveal the answer in 5, 4, 3, 2, and the C's have it. Give yourself applause. So, children have higher metabolic rates and smaller lung volumes. So, they need to breathe faster to meet their body's oxygen demands. For example, a normal respiratory rate for an infant can be as high as 30 to 60 breaths per minute, while an adult's normal range is 12 to 20 breaths per minute. Recognizing this difference helps CNAs and PCTs identify abnormal breathing patterns across age groups. When you take your test, usually your CNA examination is geared toward older adults, the adult population. Once you pass your CNA examination, you can work anywhere that a nurse works, including the children's hospitals. I need for you to go back and study pediatric vital signs, pediatric illnesses before you go and apply at a children's hospital, because you can definitely apply, but we want to make sure that when they're asking you questions about, why do you think a child would be in the hospital? Respiratory, to injury. So you need to be able to speak their language. So when you're studying for your test, you're focusing on adults. But after you pass your test and you want to work with kids, go back and study a little bit more before you interview. All right, question 50, you all. I can't believe we're at the end of our practice test. All right, question 50. A newly admitted resident in respiratory isolation for pneumonia ask why they have to stay in their room. What is the best response? A, you are being punished for being sick. Well, we know that's not the answer. B, this prevents the infection from spreading to others. C, the nurse will explain it to you later. Or D, you only have to stay in your room for one day. I see you, Elizabeth and Ruthland and Roy and Kelly and Fabian, Jennifer and Chrissy and Angelica. So everybody revealing the answer in 3, 2, and if you chose B, you are right. So respiratory isolation prevents airborne or droplet infections from spreading to the other residents and the staff. So when someone's newly admitted, they haven't even had a full day of antibiotics. If I'm their nurse, I'm going to highly encourage them to stay in their room. If they just insist on getting up and walking around, if they're strong enough because they have respiratory compromise, otherwise they wouldn't be in the hospital, I'm going to have them walk around with a mask on, because it just wouldn't be safe for the other people to have them walking around with this germ and they're coughing in the hall. They're going to get us sick and we're going to turn around and get our other patients sick. So usually, initially, when they're in the facility, until, we've had an improvement in the chest x-ray, an improvement in the vital signs, maybe their O2 status better, they're less febrile, they need to stay in their room to prevent the spread of germs. And so you all, so Mary says, do your clinical skills videos, are they good for Texas? Mary, we have people from all over the world who uses our videos. So what I would recommend, Mary, is that you look at the test plan for the CNAs in your state. And if it says the same skills, then yes, our video should be good. But please look at the care plan. They're usually going to have like this whole package that, hey, these are the skills for Texas. And if they match, you should be okay. So everybody, guess what? You know how we end our videos. I want to remind you that caring CNAs become caring nurses. You are more than just a pretty girl or a handsome guy in scrubs. You are the difference maker. You are the person who helps the nurse, who helps to save a life. So I need you to be that caring and compassionate person. And you all, I will see you online next week. You know I love you. Mwah! I appreciate you. And if you haven't done so, please like the video and subscribe. I'll stay on for a few moments to see what questions you have in the chat. I love you all. See you next week. Thank you, Priya. And Danielle has their exam tomorrow, so good luck on your test. And for everybody who is saying, thank you, you're so welcome. Mila says the first answer was so mean. Mila, I'm sorry, it was truthful. I'm sorry if you felt it was mean. My apologies for being truthful. All right, so let's see what else. Mary says she takes her exam tomorrow. I know she's going to do well. And I see you take your exam on Friday, so good luck. You're going to do amazing. All right, and if no one has questions, I am signing off. I'll see you all in the next video. Bye-bye.